Hello and welcome. We'll get started in just a moment. Good afternoon and hello, welcome. We are so excited to have you here. For those I've not met, my name is Marie Boone Clark, and I am founder of Birthing the Magic Collaborative. We are 501(c)(3 that our mission is to create spaces like this. We curate, the fancy way of saying it is that we curate virtual education for Black working people and those who care for them. But at the end of the day, we bring together wonderful, amazing experts in their respective fields, like the two ladies who are joining me this afternoon, so that you can meet them and learn from them and talk to them and be better prepared to either support a loved one as they go through the perinatal and parenting journey, or you yourself are prepared to navigate this space. We'd love to know who's with us today. Drop your location in the chat. It was exciting earlier this week that we had people from Africa, we had people from the UK, we had folks from my home state of Arizona. I already see one of our wonderful friends, Bree, is on with us. And so it's fun to know who's on the call. But joining me are two phenomenal nurses who are also doulas and also experts in the perinatal field. And I always fumble over people's bios because I say that I can never give it justice. So rather than me trying to tell you who they are, I'm going to ask them to introduce themselves. Charity, your camera is still not on, and you're still muted. Hopefully you can get connected. We have had some tech issues. Zoom has just been messing with us, but that's okay. And you all will have to forgive me. My father was a Pentecostal bishop. So sometimes it comes out, I'm gonna say the devil is a lie. We are going to have our workshop today and Messiah is gonna come on so we can see her beautiful face. We don't know why it's not working. But Shamika is here. So we'll let Shamika introduce herself and we'll see if we can't get Messiah connected. Shamika, will you introduce yourself? Can you hear me? Oh, am I just talking? Can you guys hear me? Can you all hear me? Oh, I'm not sure Shamika can hear me. Shamika, can you hear me? We can't hear you.
Can you hear me now?
Oh, we can. Yes.
Okay. Oh yeah, I was saying that it was a delay in your video and your audio.
Oh, okay. So it's almost like and believe it or not, we're in the same state, y'all. So Shamika, I was asking if you would introduce yourself. And then Charity, my suggestion is try coming in, Charity, as a participant, and then I'll promote you to panelist. And let's see if that solves the issue. I'm going to text it to you. And while we're doing that, well, I'll ask Shamika to make an introduction.
Hello, my name is Shamika. I currently live in Northern Arizona. I have been living in Arizona for 5 years since Hurricane Harvey. Um, I've been a nurse since 2004. Really love nursing, very passionate about nursing. Went to school in Tennessee, currently in school at the Western Kentucky University. During the pandemic, we had a lot of time to sit and just read. So one of the things I came across was the maternal health, Black maternal health disparities, and it was something that I had been passionate about because I used to work in L&D and postpartum back home in Mississippi. So I started looking into doula work, and so I became a did some studies, became a doula. I'm very passionate about it. I started my business during the pandemic, also a nurse advocate, entrepreneur. So I'm very passionate about the health and wellness of Black people. Um, Reason being is because of the disparities in health, we have an issue with chronic illnesses, and we also have an issue with the increased numbers of maternal fetal death in this country amongst Black people. And one of the things that I always tell people is that we as Black people, we may serve all cultures, but our main priority is to always serve our communities. And so with Mary Can Consulting, I serve all communities, but my priority is always Black women, Black families.
Thank you, Shamika. We had a young woman reach out to us and say how much she appreciated the work, and she is not a Black woman, but what she said was, I figured if you can help a mama navigate the travails of our system, she's like Latinx, and she said, then I know I'm in good hands. And I think
Hmm.
that's true because it's good to see have people see us.
Right.
I don't know if for our audience, how many of you are expectant parents? How many of you are practitioners? I know there are a couple that I see that are practitioners, but Shamika, for those who are expectant parents, can we talk a little bit about why we it's so important for our families to have support like you as a doula? And then also, can we define the role of a doula? Because I'm also finding that the average layperson doesn't, they either don't know, they have a mindset of, oh, it's only something that very rich people do, or it's something that Erica Badu does.
Yeah.
And can we,
Yeah.
while we're waiting for Nasaya to join us, can we talk a little bit about what is a doula, what is a doula and why is it important for us to talk about Black maternal health?
Okay. So the reason why Black maternal health is important is because we're going to talk about that in the slide presentation, but it's because of our increased numbers. And that's why the Black doula is so very important. A lot of people misunderstand and don't understand the difference between a doula and a midwife. So a midwife is the person that actually is carrying out the delivery. They catch the baby. They do the prenatal actual visits, the labs. Um, they cut the cord, per se. A doula is an educator and a support person. So what we mainly do is we educate Black moms, Black fathers how during the development, first of all, the development, what is a good way to have a gentle and a healthy birth. So we are there as a support role. And the reason why it's very important for doulas is because, first of all, the studies have shown that Black women who have a doula have a lesser chance
Mhm.
of having a bad outcome with their birth. There's a less of a chance of maternal and fetal death. So, for example, there's an education piece. We educate pre, which means we educate you before you get pregnant. We have that ability to educate you before you get pregnant. We can help you with fertility issues. Then, during your pregnancy, after you get pregnant, we teach you about the growth of your baby, what the things that are happening to your body, also understanding those roles as a mother and a father who are going into the delivery space. But we also teach you what are the questions you should be asking your provider, okay? Because a lot of times with a midwife, I know one of the midwives, when I was on a call yesterday, she says her prenatal visits last about 2 hours, right? But when you go into the doctor's office, your prenatal visit might be 30 minutes with that provider. So you need to go in prepared with the current questions that you need to ask. You need to know what that provider is supposed to be doing. You need to know what your numbers are supposed to be, because if you don't know that information, then you lack power, and knowledge is power, right?
Mhm.
So we empower women to take charge of their health. And that is why it's so important for doulas to be in our communities, to continue to be in our communities, and to continue to be in the labor and delivery and postpartum space.
Thank you, Shamika. I always think it's important to ground people. We are in this space so much that I think we take things for granted, and then I'll be talking to folks, and they're like, "No," and because they're like, "Are you a doula?" "Oh no, baby, no, no science, no birthing." Uh, you guys are probably too young from the Gone with the Wind movie where she says, "I ain't birthing no babies." Nasaya, we see your name now, and then the other one we saw your photo. But you're still not on camera, my friend. So we may have to just hear your beautiful voice. Shamika, you should have the ability to share your screen. I think you were kicking us off anyway. It is so strange that we can't get Nasaya's camera on.
Technology is so weird. That's all I would say. We're just gonna work with what we have. And
It
I'm
worked.
just so glad that we added her bio right to the slide, because we still will get a chance to
And we
see her
literally
face.
saw yesterday. We were
So
on yesterday. It was working fine. For those of y'all like, why did y'all prep? We prepped.
right,
We prepped, I promise you.
right,
Um,
right, right. Okay,
it's,
so let's
one
see.
never
Let me
knows.
go to share screen. Also share audio. I'm gonna share this screen. And then everyone let me know that you can also, you
We can see your screen.
it's not allowing me to share my audio. Give me a second.
Oh, okay. Let's see if I make you co-host. See if that makes a difference.
Let me stop share. Share the screen.
Yes, Yolanda, technology is interesting. So now, Yolanda, can you not hear me either? Are,
Okay, can you guys
can you guys
see the
hear us?
screen and still hear me?
We cannot see your screen, but Yolanda says our audio is gone. Oh, you can hear everyone. Okay. See, I'm like, I'm gonna need a cocktail, and it's only noon here. So now we can see your screen, Shamika, but you are muted. Nasaya. Hi. Got it. Got it to work. She got it to work. Yay. I think you're
Alrighty.
two. Do you want me to remove that other one? Okay. Now try talking to us, my friend.
Hello, everyone.
Yay. We outwitted it. Okay. We're all here. And we've got your screen, Shamika, but you are muted, my friend.
I'm still muting.
No, now you're not muted.
Also share. Yeah, so I'm going to try to see if I can share my screen and not click that thingy. Can you still hear me?
We can still hear you, but it's doing that weird thing where I'm like,
Can you guys hear me?
yes, we can hear you. And then now we can see your screen. Yay. We're all here.
Can you see the screen?
We can see the screen.
Okay. Hallelujah. Okay. Alrighty. So the title, did you want to let Nasaya go ahead and do her introduction?
We
Or
can.
you want her to just do it with her, because her slide comes up with her bio. We can do our introduction with that.
Yeah, we can do it then.
Alrighty. So everybody welcome in. Thank you for all the technical difficulties. We made it. Okay. So today's discussion is talking about labor ready, the must ask questions. This presentation is part of a 4-hour training class that I do through American Consulting. It's called Kings Protect Your Queen. I do it for Black fathers. So a lot of this may seem like a lot of information. It is truly compressed, but we will have opportunities after each section for a few questions, okay? So just bear with us. The key to a gentle birth is an informed pregnancy and healthy body. And we are going to go through all of those things in our presentation today. My name is Shamika. I am the nurse advocate entrepreneur, better known as the Epic Doula. Epic being, I started this back in 2020. The Epic Doula is something that my daughter came up with because I'm a very excited person. I'm a very patient person. I'm a very innovative person, and I'm a very caring person. And you need all of those things to be a doula in all aspects. I am perinatal mental health trained through PSI. That was offered through the Arizona Birth Workers of Color. I am working on that certification. My motto at American Consulting is our goals are holistic based. We offer assistance with coordinating care between all your medical and behavioral health providers, obtaining a natural cannabinoid system and gentle births. Let's follow you to wellness. Enjoy your flowers now by living your best healthy life. And below is my contact information, my email address, and my phone number if you need to get in contact with me. Nasaya?
Hello, everyone. I'm Nasaya, Charity Nasaya, and I've been a registered nurse for 20 years. I have an extensive background in home health, holistic care. So I meet my clients in their homes and I help them to have a better quality of life. I am also the founder of Yaya's Birth and Beyond. Started off as a full spectrum doula. Now I specialize in postpartum doula care. Particularly for new moms over the age of 35. I am a lactation consultant studying to be a IBCLC. So that's a lactation consultant that could help you if you have any feeding complications with your baby. I also, advocate for any way you can feed your baby, not by the chest or the breast. And so I am very, very passionate in helping women to understand that they have the power to heal and to help them to have a great quality of life, transitioning from just being, who they are into a mother.
Thank you, Nasaya. So we're going to get started with the presentation. There will be opportunities for questions. We ask that you post the questions in the chat, and we'll get to those questions at certain intervals. Okay. So why Black Maternal Health Week? These numbers came from 2018 to 2022. Okay, and as you can see, these are the maternal mortalities. So these are the moms that have died between 2018 to 2022 by race, right? So for white women, we have 2018, 19, 20, 21, 22. So the numbers did go up in 2020 for all categories during the pandemic. So we're going to focus on this 2020 score. So as you can see, white women 26.6, Hispanic women 28.8, Asian women 16.8. But for Black women, it is 69.9. So everyone wants to say, well, Black women have less prenatal care. They have less access to money, right? So let's talk about that. So we have women that are on Medicaid. We have women that are white that are on Medicaid. But when you do a comparison, the numbers still remain the same. We have women who are middle class America that are our Black women, but they are still finding themselves in situations where providers are not listening to them. As we have seen with Serena Williams, she could have died on her bed after she had her child if she had not advocated for herself. So we have Black Maternal Health Week because we want to emphasize the importance and the rights. Being a Black mother is a birthright. It is our right to not die while giving birth to our child. So, what can we do to make sure that we can decrease these numbers going forward? Education is the key to advocacy. So, Nasaya and I are going to break up these sections of this presentation. The first part of the presentation is we're going to prepare you for the prenatal appointments. Then we're going to talk about the importance of prenatal labs. We're going to discuss developing a strong birthing plan and the importance of relaxation and exercising. Following that, we will have some case studies. It will be interactive, and we'll get a chance to look at 3 situations where advocacy in the women's health space is important. Prepare for prenatal appointments. So your prenatal appointments, you don't want to wait until after your first appointment to prepare for your future appointments. Okay. So the first thing you need to do is everybody wants to make their first appointment with their midwife or their OBGYN, right? We encourage moms to make an appointment with their PCP, their primary care doctor, and their midwife or OBGYN. Why would you want to do this? Well, your primary care doctor is responsible for your entire health. Your midwife or your OBGYN, they are specialists. They are only able to care for they are only certified and they specialize in caring for your health while you are pregnant. This also takes care of any illnesses or anything that you might have while you are pregnant. You can go to your primary care doctor for things like a head cold, a stomach virus, or any allergic reaction. It also clears up appointments for other women trying to get in to see the midwife or the OBGYN. What do you need to ask when you make these appointments, when you're in these appointments with your PCP? You need to ask for your OBGYN, how frequent will my appointments be? My clients, they get a copy of the ACOT schedule. The ACOT schedule is a schedule of how often your provider should be seeing you while you are pregnant. They have this in their binder. So you want to ask your OBGYN, how often will you be having these appointments? What can I expect at these appointments? What medications do I need to start or stop? That's why it is important to have a copy of your medication list when you go to each appointment with your PCP and your midwife or your OBGYN. What over-the-counter medications are safe? If you are also on Medicaid, you need to understand your rights in choosing a provider. Here in Arizona, Access does allow for you to have a midwife or a doula. However, Access here in Arizona does not pay for home births. You can have your birth at a birthing center or a hospital. That is something you need to discuss with your primary care doctor and your midwife when you are deciding where you want to have your birth. You also need to schedule an appointment with your dentist. We do know that your nutritional requirements during pregnancy will be higher. Lack of calcium can cause your teeth to deteriorate. So you do need to schedule an appointment with your dentist and have a dental exam. As I stated before, you do need to make a copy of your medication list, your family history, your advance directives, and determine who will be your birthing support person. And the reason why determining who your birthing support person will be, there can be a lot of high energy and a lot of chaos in the birthing space. When you are in a high stress situation like labor, you do need one person, and not multiple people speaking for you or speaking to you at one time. Your focus needs to be on having a safe birth for yourself and for your child. Another thing that was left off of this presentation is when you make that appointment with your primary care doctor, you do need to request him and ask him, what was my last vitamin D levels? If your doctor says, well, I've never checked your vitamin D, then you need to request it at that time. If you are brushed off and he says, oh, we'll just worry about that later, at that time, you need to say, I want it noted in my chart that I requested for my vitamin D levels to be checked and that my request was denied. More than likely, that will initiate that provider to go ahead and get that done for you. Okay, do we have any questions in the chat before I move on to this prenatal flow sheet?
I'll check the chat, but while we're doing that, my first question is, can you tell us why it's important to have our vitamin D level checked?
Yes, so vitamin D, which we normally get from the sunlight, vitamin D is what you need. It helps the absorption of all the other nutrients that you intake. So if your vitamin D levels are low, then it's going to be very difficult for other nutrients to be absorbed for use in the body. So you want to make sure that your vitamin D levels are at a normal level.
Thank you.
Mm-hmm.
And is it generally covered by insurance?
Yes.
Okay.
And if your levels are low, there's no need to panic. Especially here in Arizona, a lot of us avoid the sun because it is hot. There are various supplements, creams, things like that that you can safely take during your pregnancy to supplement a vitamin D deficiency.
Thank you. And it's not unusual for vitamin D levels to run lower in people with more melanin in their skin anyway, if I recall, right?
It is very common to have a low vitamin D level. And also we also have to think about from a science perspective. Um, I was born in the 70s. We're gonna leave it at that. So the way we got our vitamin D was in the sun. But because of things that have happened in the climate and things like that, the sun is not really a true source of excellent, I guess you could say, pure vitamin D. You can still get it. However, we can't get the absorption the way that we used to do in the 90s. So it's very, very common to have a low vitamin D level. And that's why we are also seeing an increase in depression in the US population as well.
Oh, that's a good point. Thank you.
Mhm.
Um, I don't see any questions. Well, there was one about would the slides be provided, but I answered that we will provide the recording. I don't see any other questions. If you guys have some, raise your hand or drop them in the chat and we'll continue chatting.
Okay. Alrighty. So for your prenatal visits, like I said, my clients, they receive a copy of the ACOT schedule and their binder. They also receive this, which shows what should be happening at each prenatal visit, right? So doing early on in the pregnancy, a lot of things will not be checked, like your fundal height might not be checked. And that is what this FH is. I put a key here. So GA is gestational age, BP is blood pressure, WT is weight, FH is fundal height. This is the number of fetuses. This is the presentation of the baby. This is the fetal heart rate. Is there fetal movement? Are you in any type of preterm labor? And these two relate to the cervix, whether it's dilated, effacement, and what station. If you've had any ultrasound, any edema, and your urinalysis. What is very important to know, and what I have seen as an auditor, is that several things do not happen that should happen at each prenatal visit. Okay. At each prenatal visit, your blood pressure and your weight should be checked. Okay. The fetal heart tones should be checked. Okay. And your doctor should be getting a urine sample every time you go to a prenatal visit. Your urinalysis is going to tell a story about your hydration. It's going to tell, it will also tell about if you have any diabetes, if you have any protein in your urine, if you have any ketones or sugar in your urine, if you're having a urinary tract infection, and all of those things affect the health of your baby. One thing that they should also be checking, they should be checking for edema. So, one thing I encourage moms to do is when you go in for your prenatal visit, take off your shoes. And if they do not check you for edema, even if you know you don't have any, we have to help train doctors, providers that this is something that they should be doing. So they should be checking your urine and they should be checking you for edema. Okay. So they should be checking your blood pressure at every visit. They should be checking your weight at every visit. They should be checking fetal heart tones at every visit. And they need to be checking if you have any edema or urine and getting a urine sample at every prenatal visit. Now, if you guys will see here, okay, I marked out these comments, but I wanted to make sure that everyone sees that this mom was 37 weeks, 5 days. The provider dropped the ball because at 37 weeks, he did not check the presentation of the baby. So we don't know if the baby has turned or anything yet. Between 36 and 40 weeks, your doctor should be seeing what position your baby is in. He checked it at 36 weeks, but when she came in a week later, a lot can change, and he did not check it. Okay? So we want to make sure that our doctors are doing everything that they're supposed to do. he should be checking all of these things 36 weeks and beyond. Okay. Also want people to understand that you will.
Could we stop here? We have a question.
Sure.
Karen, I've unmuted you if you want to ask the question. Or did you mean to raise your hand? Maybe she didn't mean to. Okay, I'm gonna pick her.
She can post it in the chat.
You can post it in the chat. Okay, you go ahead, continue. Sharon, if you, I had unmuted you so you could ask your question directly, but if you want to drop it in the chat, that's fine. The question, one of the questions at that point though, Shamika, is at what point is it too late to change providers? So if my doctor is not, you know, if I know now, and we're gonna create a list with Shamika to share with you guys, that if I, you know, if they're maybe they're doing the urine test, but they're not, or you know, checking the baby's heart rate, or when is it too late for me to switch? So in this case, if we could go back to the case study that you had pulled up, or the example you had pulled up, the mom was at 36, 37 weeks. What should she do in that instance? If she's smart now, you've told her, what should she say?
Right. So this is just a week in between, right? So he didn't do it here, but he did do it here. So he checked it at 36. He didn't check it at 37. But at 38, he did start checking her cervix. So in this situation like this, it's an educational moment for your provider, right? So you're at 36 weeks. You're going to deliver in about 4 weeks. It's going to be very difficult to change providers.
Mm-hmm.
So you have to ask yourself, how has my care been prior to this? So that's why you have this binder, because you really need to be solid and trustworthy of your provider within that first trimester. First trimester, you need to make sure that you have a safe provider within that first trimester.
Okay, so that's one of the questions. So we need to decide if we trust our provider during that first trimester.
Yes, that's why you have a binder, and there's like a whole list of questions that I have that's in my for my doula, my prenatal and labor and delivery clients. They have these questions that I ask. And most of my appointments with them is in the first, when I travel with them to the providers, the prenatal appointments, I go to them with their PCP appointment. And then I go with them to their first 2 prenatal appointments. And then we go to the last, those last couple of weekly appointments that's in that last trimester. This is where you get a feel for your provider in that first trimester. That first 20 weeks, you really do need to be asking the questions, determining if your provider is going to listen to you. Is your provider going to follow your birth plan? Is your provider doing what they are supposed to do? And a lot of times they just get in the rhythm of doing things. And a lot of times all it takes is to get them to do a pause and to do these things. Because many times it's not intentional, but as a Black woman, they looking at you like, oh, you already got this. I ain't got to really do no much. I don't really have to do anything. Black women, they got it, you know.
Mm-hmm.
I'm just here to get the check from the insurance company. I don't mean to be rude, but that's how it is.
And that's, no, we're transparent here, my friend. And so
right.
I'm at week 36, and he made the check at week 35. He doesn't do it at 36. I've been in this workshop with you. I know that he should. Before I leave that office, or before he leaves the room, you know how he rolls. Should I say, what shouldn't you do?
Correct.
Okay.
Correct.
Okay. That was one of the things. So, and then so we answered the question. And I also dropped in for the benefit of anyone who is like, trimester, wait a minute, how many is that? We dropped that in. And then we asked, did we answer your question, Yolanda? I think it was a two-part question, and I think we got it if not. And then Sharon, I see that your hand is up. I don't know if you are raising your hand to talk or if you just are hitting the button. But if you could drop your question in the chat, that way we can make sure we don't miss what you want to share. And then I will let you keep going, Shamika. This is so good. We almost need like a little book or something.
Okay. Well, I am so nervous, you guys, because let me tell you, and Nasiah can attest to this. I do not like being in front of people.
And
I do not like being in
because you
front of
have such
people.
wonderful energy.
I do not like being in front of people. It makes me so nervous. And that is why I chose Nasiah to be on this presentation with me, because not only is she a beautiful soul. When I say a beautiful soul, it's kind of like our energies just connected with each other. She's also from Mississippi. And so she's a calming for me to be on this presentation today, because I promise you all, when I'm one-on-one with my clients, I'm good, you know. But in front of a crowd, I get so nervous. I
Oh,
get so nervous.
but
So
just
I
continue
just want to
talking
thank
to Nasiah.
everybody. Yeah, I want to thank everybody just for being on here.
Yeah.
And
And they're
my
giving you
email is,
love in the
I
chat. They're
provided
giving you
my
love in the chat.
email. And if you have any questions, I always answer my emails. But just another shout out to Nasiah. Thank you so much just for being beautiful and my support person.
What,
So, but yeah.
it's my support person. How could she be yours?
So yeah,
That's how
so
you said that she is. They're giving you love in the chat, Shamika. And I just want
oh,
you to know,
thank
if you
you.
are, we're among friends here. And if they're not, we'll remove them. Look.
But yeah, so and then
But
we also got to think
you're
about,
doing a beautiful job. And
yeah,
I just think this is so important when you suggested this topic. And for those, Shamika and I met at a book club, and I just fell in love with your energy. And she is so bubbly. And if anybody that's in Arizona and you need a doula, these two and then our lactation girl is but then Bree is also a beautiful doula. And but we just want you to learn. We want you to be empowered. We want you to know, because this is someone's real chart, that Shamika, and we don't get a chance to, we hear about it, what is the word? Theoretically, about docs
mhm,
missing things, and it's not an indictment of all physicians, but they miss things, and these things
right,
can be critical. So I
right.
won't take any more, but
Yeah.
you're doing a
I wanted
beautiful job.
to I got the permission from my clients. We removed the dates and we removed and this, just so you know, this was a 2024 birth. Okay. So
So we're
this
not
is
talking
not
about something
something,
else. Yeah.
right. This is something that has happened recent. So our work is so important. The work that we do is so important. And I have a passion for Black women. The reason being is because, and I'm not going to step on anybody's toes. If I do, just say ouch. But Black women gave birth to the world, and it is our birthright. We should not be experiencing maternal and fetal deaths at the rate that we do. Okay. So I am an advocate. And when I get the courage and I get the strength and I see something is wrong, I speak up. I find the strength. So I just thank everybody for allowing me this space to advocate and to teach, you know, be a voice for Black women. So we're not gonna get the crying up in here, Nasiah. Let me
Oh,
move
I'm at that
on.
age where it's high. I'm really,
Let me get to moving on. Okay, and so
but
we
they're giving you
discussed
love
all
in
these.
the chat. They're giving you
Oh,
love
thank you
in
so much.
the chat.
So this is one of the things that I find it, because we have to know what should the doctor be doing at each visit. And so this is one of the examples. You know, I provide something like this to them, and I get a text, you know, because my clients, they have their own ringtone, they have their own text. And so they might text me and they say, well, my appointment is this day. And I said, well, you're at this week. What should your doctor be checking for? And they go to their binder, and then they know what they're supposed to be checking. So they get a prep with me prior to the appointment for the appointments that I don't attend. It's very, very important. And that is what a doula does. A doula is a person that teaches you, educates you so you can advocate for yourself. Now, as a nurse advocate, I can serve as another role as an advocate. And so my clients do have the opportunity. Do you want a doula or do you want a doula and a nurse advocate? So in that space, which is good for especially my high risk moms, when you're in the birthing space and they are advocating hard for themselves, their birth support person is advocating for them and the provider is not listening to them, then I'm able to step into a nurse advocate role with them, right? So everything kind of works out, but ideally, I really encourage, usually, most likely, they do listen because you have been educated. So, Black women, we do need to be educated because this is our life and it is the life of our nation. Okay, so let's see, let's move on to the next one. Okay, so when you go in, they're going to calculate your estimated date of delivery, which is your EDD. You're going to see EDD in several parts of your chart. So your first EDD is going to be calculated using your last menstrual period. If you are one of those people that have an app, then you know exactly when it was. Or old school, like me, like my mom taught me, we put a little dot on the calendar so we know what's the first day of our period, our last period. So that's when you have your EDD calculated. But then you might go in for an ultrasound and they do an EDD based upon size. Do not be frightened when those two dates do not match. Okay? They should be similar. They shouldn't be off by many days, but stay calm. The baby is going to come when it's ready. As long as you have a general idea of when that baby is coming, it's going to come when it's ready. Now, if your ultrasound EDD and your last menstrual period EDD is more than 2 weeks off, then you might want to reevaluate. Did I really know when my last period was? Or did you make a guesstimate? Or am I going to have a larger baby than I thought? And that's a lot of times doctors do not take into account the Black body. A woman's body is going to carry the size child that it can carry, right? However, when we get to talking about nutrition and we're taking in too many carbs and things like that, it can cause you to have a larger baby. Now, keep in mind, you're not going to have an ultrasound probably until 20 weeks. So, how much have you been eating to make your baby a little bigger to make your EDD be thrown off? Okay. Stay calm. Just remember, the baby is going to come when it's ready. These EDD dates are not set in stone. That's why it's called estimated. Estimated. So, what we're going to do is we're going to make sure that we're healthy, we're exercise, we're taking in the proper nutrition. And so, when the baby is ready, it will come. Okay? We're not going to panic about all these different EDDs that's going to be in your chart. Matter of fact, just think about one date and call it a day, okay? We're not gonna panic about EDDs. Okay. Also, one thing, this is a document that doctors usually do not use until after you have had your baby. For my clients, they have a copy of this. And the reason being is because you need to be assessing for depression throughout the entire pregnancy. It will help keep you and your baby out of the danger zone. So they have various forms of this document. And like I said, I have all my clients, they have a copy of this to their binder. I evaluate them each time I visit with them in their home, and I encourage their husbands or their birthing support person to evaluate them as often as they need. If their mood is off, if you see them just laying in the bed, you know hormones are going a little wild while you're pregnant. Don't just assume it's just pregnancy hormones. Let's do this depression screening. Have them answer all these questions. It's going to give you a score. If the score is within that danger zone or close to that danger zone, then you need to immediately make an appointment with your provider. Call your doula, call your midwife, make an appointment with your provider. It's not a should I, it is a must. Depression, suicide, people have been having so many issues with during pregnancy that they don't catch until they're in the postpartum period. There are ways to treat depression safely during pregnancy. We do not want to wait to the postpartum period after they have now a crying, demanding baby and then try to start treating the depression. Let's start catching the depression before then. Okay? Does anybody have any questions about the last two slides? You're muted,
I
Marie.
said just lots of truth and facts and I'm over here, I'm just taking notes.
Oh, okay.
I had the music, they all would hear me going click, 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 click. I can't write fast enough.
Right.
This is, and I can't echo Shamika enough in terms of, you know, heed the concern. I mean, that around one's mental health, and we've got to get past thinking, oh, that means I'm crazy. We got to get past the stigma that
Mhm.
that we as people of color we tend to assign to it. And I was sharing with someone recently that I believe faith is critically important. And so we can have faith. And again, my father was a Pentecostal minister, but faith without works is dead. And the work is acknowledging that I need a little bit more. And
Mhm.
I believe Arizona, for the state of Arizona, the primary cause of maternal death is now mental health. It is not cardiovascular disease. And so that's a preventable death if we can acknowledge and get the support that we need, and to have people like Nasaya, Shamika, Bree, I think is that's on the call with us is a PMHC or at least has had the training. There are people who are culturally congruent in our community that are there to help you. And then if not in Arizona, there are those who are across the country who look like us and will treat you with the dignity that you deserve. So, but no questions. Just wanted to echo you.
Right. Yeah, right. And I was going to say, like, Nasai and I both are perinatal mental health trained. And there are, and a lot of people, we can talk about that. And so for the perinatal mental health trained, what that means is we have been trained to specialize in mental health that affects women during the labor and delivery space, doing the prenatal, postnatal, perinatal space. So it's not a whole blanket of everybody. It is specifically
Mhm.
for birthing women, their families who are experiencing that. And it's intense. And Nasaya can really attest to how thick our book was, how many conditions that we had to go through, not just the medication names, the different types of medication, the different categories of medications. When you have this situation, then you do this. So it's a very extensive training. And the reason why the training is extensive is because it is a mental health crisis.
Mhm.
it is a mental health crisis in this country, and we're already dealing with maternal fetal death, and now we're adding the aspect of mental health with that. So, just want to thank those that joined the call today, because a lot of people don't even know what PMH is, um, and just wanted to add that, Marie.
Thank you. No, I audited the class. I can't say I took the class. I was in the room. But don't ask me.
Right.
It's a
Yeah,
lot. It really is a lot.
it
And
is.
I think that if you have some sort of clinical background or you've worked with in the perinatal space before,
Right.
it was a lot. It's a very important learning. And they ensure that you are prepared. And to Shamika's point, someone who does not generally focus on perinatal health will not understand. The other thing that was aha with a workshop we had earlier this week was our speaker, who is also a PMHC in Atlanta. She talked about how depression and anxiety and other mental health conditions present differently in Black women. And so what some providers, when they're checking or looking at your behavior, we may not sit around and cry, according to Tamara. Ours can present as anger, ours can present as frustration. And so having someone who's cognizant of that is so critical. I'm done. I'm not going to say anything else because I want to get to the next good part.
Speakers. Mhm, mhm. Absolutely. Absolutely. So, and one thing I liked about our PMH training is that it allowed the opportunity for us to be facilitated by a Black doctor, a Black female doctor who understood the journey, who doesn't, I won't say understood, who understands the journey, who understands the difficulty, who understands the biology, and for
Mhm.
her to have the difficulties that she had herself,
Mhm.
in the birthing space. That was a real blessing to have her teach that class.
Was it Christopher Holloway? Was that who taught your?
Yes.
I love her. She is.
She is so
Actually,
funny.
if you guys were, if it was the right year, the year that she taught, one of the years she taught your class, I met her for dinner because I'd stalked her.
Really?
I wasn't in the class, but I met her for dinner that night. Yeah, because
Okay.
I saw she was coming, and it's like, oh, I've got to meet her. I love her. If you guys don't follow
Yeah.
her online, Christopher Holloway. She's in Georgia,
Mhm.
but she is phenomenal.
She is. We call her Dr. Christie.
Yeah.
Yeah. Yeah. All righty. And so now we're going to move to prenatal labs. So it's going to take a bit for these prenatal labs. Marie, from my understanding, you were going to provide them with the copy of some of the prenatal labs when you sent the.
They created, I dropped it in the chat. What not
Okay.
they not the they created what the doctor will test.
Okay.
Or like just what that, but do you want me to create what the numbers should be
So
or anything?
I will send you a copy out of my binder. It has what the normal results should be.
Oh, that would be great. Okay.
I'll send that to
Yeah,
you
we're
later.
not that medical. They just said what they
Right.
should be looking for. Okay.
Right. Okay. So when you go into your doctor's office, he's going to do a panel of tests, all these different tubes of lab, right? So one of the things that you want to make sure, we've already talked about urine. You want to make sure he gets that urine. And reason being that I'm always talking about it is, as you can see, I've highlighted right here, test not performed, test not performed, test not performed. So they didn't check her urine for ketones, didn't check her urine for glucose, didn't check her urine for protein. And this is a critical test when you're doing this because it goes to kidney function. It goes to if you're diabetes, if you're not managing it well, it's a precursor to let you know, hey, I might be itching towards gestational diabetes. Your urine can tell so much about you. So I really, really emphasize, I can't emphasize enough that your doctors check your urine at each appointment. I don't care if you've gotten down to 36 weeks and you're going every week. A lot can happen in a week. He should be having you urinate in a cup and checking your urine. If he doesn't do it, demand it. And if you, after you demand it and he says, I'm not going to do it, then your response is, I want it documented in my chart that I requested that my urine be tested and that my request was denied. That is the verbiage that I teach all of my clients to say. I requested XYZ. My request was denied. I want it documented in my chart. You should be saying that whenever you ask for something and your provider denies you, no matter how minuscule you think it is, have them documented. So one of the things that
One
we
more
want to
time, I
make
couldn't
sure,
type it I'm sorry, I couldn't type it fast enough. I want to document it in my chart that I requested, whatever you've asked for.
XYZ,
Uh-huh.
and my request was denied.
Okay, thank you.
All right, so we want to make sure we want to talk about this. A lot of these, the RPR, the HCV, a lot of these HIV, that is mainly for checking for sexually transmitted diseases. So we want to make sure that you are STD free. Okay. That's a given. However, we also want to make sure that your white blood cell count is normal. Reason being is the last thing you want to happen is not be able to fight off an illness while you're pregnant. Okay? You do not want your white blood cell count to be low. So your red blood cell count, hemoglobin, and hematocrit. So your red blood cells carry the oxygen to all of your organs. You want your organs to be oxygenated. You want the blood that's circulating to you and your baby to be well oxygenated. Okay. So we want to make sure this red blood cell count, this hemoglobin, and this hematocrit is within a normal range. So as we can see right here, the normal range is 34 to 46.6 for the hematocrit. Hers is a 29.2. It's a little low, right? And I can tell you that in this chart, he did not address it for this client. He did not address her low hematocrit. Her hemoglobin for a woman should be 11.11 to 15.9. It's 9.7. Wasn't addressed. So are you taking your prenatal vitamins? Are you taking your iron? Are you eating iron-rich foods? But as you can see, none of this was flagged in the chart as being abnormal. But we can see here what her values are and what the minimum should be. Her hematocrit is 29.2. The normal is 34.0. The hemoglobin is 9.7. It's 11.11. And as you can see, it's marked low. These levels are low. So if her red blood cell count, her hemoglobin, her hematocrit are low, her organs are not getting enough oxygenated blood, which means that guess who else is not getting enough oxygenated blood? The baby. The baby. So that's why prenatal vitamins are important. Iron is important if you're deficient, and eating iron-rich foods. So at this point, when the doctor takes your lab and he looks at it, he's like, oh, well, your blood count's a little bit low, but that should improve with, taking your prenatal vitamins. That's where we pause. And your question next will be, what are my actual numbers? What are my actual numbers? And he's going to look at you like, well, And while he's looking for your numbers, you're switching to your binder and you're going to go to the lab tab and it's going to show you what your normal should be. So he's going to tell you, oh, well, yours is just a 9.7. It's a little low. It should be 11.11. So your next question is, what should I be doing to increase my numbers? And he should have an answer for you. If that provider, now all of this lab is done all within the first trimester. If that provider does not have an answer for you, run for the hills.
Now, can we
Run for the hills.
clarify something, Shamika? Because I don't know Arizona, I have to confess, but there are some communities where you don't get to see the doctor until you're 16 weeks, you're 18 weeks. We've even heard people say that 22 weeks almost, because they're waiting, well, not waiting, but that's the earliest they can get in. So we're past our first trimester at that point. What am I still going to try to find
So
another at 16 weeks?
there, you should be calling around until you can get an earlier appointment.
Don't wait that long. Okay.
No. And there are some resources that we are going to have at the end of this slide, especially for Black women. You can always contact the Arizona Birth Workers of Color and see if they have a midwife that can be able to get you in sooner.
Okay.
We should not be waiting that late for a prenatal appointment, because your prenatal appointments is where you're going to get these labs. You're going to get your baseline to see where you are. And you don't want to see where you are into your second trimester. If your iron levels, if your hemoglobin and hematocrit and red blood cell counts have been low for 20 weeks, that is 20 weeks that your baby has gone without sufficient oxygenated blood. We have to advocate not just for ourselves, but for the unborn life that we're carrying. So we have to be proactive and not just taking whatever. Oh, I can't get you in until this day. Okay, click. I'm calling another doctor. Call until, what they say, pray until something happens. Call until you can find another doctor. Call until you can get into an earlier appointment. Another thing that is on what we did not see on this list is the vitamin D level. And a lot of providers will not check that vitamin D level. And a lot of people don't understand that your vitamin D level is what's going to help that iron to be absorbed more readily in the body. It's going to help that bioavailability. Okay. So that's why it's important to ask for those labs. Does anybody have any more questions? We're good. So we're going to have an appointment prior to 20 weeks, and we're going to have it within that first trimester. We're going to ask what our numbers actually are. If our numbers are low, we're going to ask the provider, what can I do to improve those numbers? If he doesn't have an answer for you, then we're going to find another provider. Okay. All right. So now you're prepared. You got your binder with all your questions. You got your information. Now what you going to do? You got all this information. Okay. What are we going to do next? My good sister Nasaya is going to take us through developing a strong birthing plan.
All right. Thank you. Thank you there, my Mississippi nurse sister. So I am so excited to share doing this about your birthing plan. So I also want to just make everyone aware that it's good to go ahead and start to work on your birthing plan. And when I say birthing plan, we all have this idea of what we want our birth to look like, who we may want in the room with us, but it's also really important to ask your provider, your doctor who you see, whether it's a midwife, whether it's a nurse practitioner, whether it's your OBGYN, how they usually like to see the birth that they attend go. And then you also want to get the policies of the hospital that you plan to deliver at. You can get that information when you do a tour of the hospital, because some hospitals have restrictions on what you can't do and what you are allowed to do, especially in a certain point of your labor and delivery moment. So I really just encourage everyone to have a plan even before you go to the doctor. Just write it out. What you want your birth to look like, what you desire to have in the room with you, who you want to have in the room with you. And what I do for the members of my community is I have a consultation and we go over every possible thing that could happen, or each situation is different, but there's our basic foundations that you should have on your birth plan. So what you're looking here at on the screen is a standard set of admission orders that the doctor will follow when you are admitted to the labor and delivery unit. So that includes, your history, allergies. I know it's really small, but I'm just going to go over a little bit. The activities that you can do that are permitted, labs, and just different things, order sets that we nurses call it, that we follow in the event of a labor and while we're going through labor with our client. So one thing also that I like to make everyone is aware of, you can go in and when you have your birth plan, make sure that you have copies of it. Whoever you want your support person to be in the room, make sure that they are aware of your desires, such as after you have the baby, will you be able to do skin to skin? Will your partner be able to do skin to skin? And that's when, after the baby is born, they place them on your chest or on your partner's chest, and then that is a way of connection. Um, if you are able to drink or eat while laboring, that could be on your birth plan. Under certain situations, eating and drinking is not allowed. So you just want to make sure that you know all of your rights and what you will be able to do before birth. Now, keep in mind, I come from a nursing of 20 years and a client, a mother. I had my children 12 years apart. I was a teenage mom at first, but I was also a nurse. And would you believe I had my baby at the hospital that I worked at with nurses that I worked with on the floor, and I still had to advocate for myself? So that's why I'm so passionate about helping others and telling others, if something isn't right, then say something, speak up. Make sure that you have either a doula or support person. That could be a trusted friend, it can be a trusted family member that knows how to speak up if something doesn't look right, or if something is going on that you feel like you may not have full consent or information on. Speak up and say something. So one thing that you could also talk about is as you progress in your pregnancy. So don't wait until you're a couple weeks from having a baby to do a birth plan. Let's start second trimester in your 20 weeks, because things may change depending on the position of the baby. If your baby is breech, there may be certain things that you would not be able to do while you're in the hospital. So one thing that we can do, know your rights and know your choices. This is very, very good to just be aware of and have with you. So one things that we talk about in a birthing plan is during labor, are you able to move around? And later on, we're going to talk about exercising and relaxation. And sometimes, because if you go in an emergency situation or something expected to come up, you may just have to lay in the bed. Sometimes, if it's just a planned pregnancy and things are going on time, you'll be able to walk around. You can have a IV that's hooked up to you and a pole, or you can be on monitors. Some hospitals have portable monitors where you can wear the monitor and you can walk around. But these are just some things that you want to talk about with your provider, what you prefer. Now, in some situations, it will be critical for you and the baby to have IV fluids, especially if you're in PO, nothing by mouth. You can't eat, you can't drink anything. And then there are also lines where you can write in whatever you feel would be necessary. Like, I know COVID was a big time. They didn't allow anybody into the delivery room. Well, now they're kind of more lenient on their visiting hours and how many people that they can allow to be in the room with you. And of course, if you're in a surgery suite, you only have one other person there with you. So we can go to the next slide, Shamika. Okay. And also, you can take things for your comfort to the labor and delivery room with you. Now, depending on your hospital that you're going to birth in, some hospital provides like the birthing ball, the stool or the chair if you want to have your birth in the tub or in the bathroom, or if you want to squat, they have a really neat squat bar that they can put over your bed so you give birth in a more natural position than on your back. So these are some of the things that you want to be sure that you talk to your provider about if it will be allowed or if it's something that is on a situation by situational basis. So you can do a shower or you can birth, take a shower or in the bath. Okay, you can go to the next one here. Anesthesia options. So, anesthesia is another way for pain control. You want to be sure to talk to your provider how they handle pain control or what your pain options will be. If you want an epidural, if you want anesthesia, if you don't want anesthesia, if you just want the gas. There are so many different ways now that you can have pain control. And you just want to be sure that you know what at what moment, if there's a cutoff when you cannot have pain medicine, how up until how long you can have pain medicine. Because pain is a really, really big thing that needs to be controlled, and the more control that you have over your pain, you can just relax and your body can birth your baby naturally. Another thing that you want to ask also is what you can have in the room with you. Sometimes I know we're in a more holistically viewed world now, perception of things. So you can have like essential oils or herbs or relaxation music. Um, I know at some hospitals they allow the dads to bring in their video games because that relaxes like the dad while, we're taking care of the mom and the mom is in labor. So you just want to be sure that you know or have an idea of what you want, how you want your pain controlled during labor. All right, we can go to the next one, Shamika, there. All right. And again, here we have some things. If you want a vaginal birth, you can have, if you want a mirror, if you want your labor partner to be present, if you want the room quiet, if you want the lights dim, if you want soft musical playing, and you can also ask, this is because a lot of research is coming up on this about delayed cord clamping. That's where the baby stays connected to the placenta until the blood is transferred from the placenta, the afterbirth, after the baby is born, to the baby. They get more oxygen and more of the red blood cells from there. So I know it could seem like a lot, and these are just some options, um, you know, for your baby and that you can talk about with your provider. Now, all the time, your birth plan, and I do give this as a disclaimer, your birth plan may not be followed step by step because there have been some instances, and I hate giving away my nurse's secrets, but I want to be real with y'all so y'all can know what to expect. Sometimes they'll take that piece of paper and put it over there with the other charts, and they just go on about their business because it's step by step by step. So that's why it's very important that you make your wishes known, you make your desires known, not only to your providers or the support person that you have in there with you, and also before you give birth, when you go, when you're admitted in your room, did you all receive my birth plan? May I give you a copy of my birth plan? And just let them know that you understand it may not go step by step, but everyone needs to be on the same team because we have one common goal here is to keep mom happy, safe and healthy, and to bring the baby into this realm healthy also. So just know what you would like, what you desire, and then also know their policy and procedures too. All right, we can go to the next one. There we go. Good, 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 good. I love this because not only does the mom need a birth plan, but the baby has to have a care plan also. And as nurses, I've been doing care plans for 20 years. I probably can tell you about it in my sleep, but it is just a roadmap or a guide to what you desire for your baby. So a lot of times, if you don't specifically say that you do want your baby to have a pacifier, you do want them or you don't want them to have a bottle, they'll just go ahead and do it. You just gave birth. They see that you're sleeping, your partner is sleeping, no wishes were made known, and they just give your baby a bottle, but that's not what you wanted. So that's why it's really good too to also have a plan, but everyone can just have a foundation of the desires of the mom and the partner. Also, if you want the baby in the room with you all the time, what do you want them to do when you're asleep? And I would tell you, and I always tell my moms, don't feel bad if you don't want to hold a baby, if you don't want to see the baby just yet, because both have been through a very traumatic, wonderful experience as it is, but you also are allowed time to heal and rest before you can really, really love on your baby. And that's okay. If you want them to go to the nursery after they've been checked out and you had your first hellos, that's okay too, because you do need rest. So don't feel bad about any decision that you make. Birth plans can change, and that is perfectly fine too. So just be comfortable with your choices and your decisions, and just know that you have the right to change your mind. All right. Do we have any questions about the birthing plans or your desires here? I want to really quickly go over just some relaxation and exercises, why that's important. And you can start that before you go into labor. Okay. So exercising is really good to maintain a healthy life. And whatever you do, before you got pregnant, they want you to continue to. So if you exercise 4 or 5 times a week, you want to continue that. That will help your body to get acclimated to all the changes that it's going through. And after you have the baby, kind of be what they say, the snap back. But if you don't snap back quite fast, that's okay. Just give your body time. You just want to be sure that you're exercising, you're doing some type of movement. You want to improve your circulation and your self-esteem. Yes, snapback takes time. I'm gonna tell you, my baby 25 years old and I'm still trying to get my snapback back. So it's okay, y'all. Don't worry about it. It's gonna be all right as long as everyone is healthy. Just keep moving. Do some type of movement. I'll probably have the yoga ball, the birthing ball from having a baby. You can use that after birth too. I mean, after you have your baby too. You can lift weights, you can lift water bottles, you can lift canned vegetables. Just do some type of movement, and that also helps with your circulation. It helps with any edema that may be present. Edema is swelling in your hands or your feet or your legs. You really want to get that circulation going. So movement, relaxation. Now they have, now they have prenatal yoga specialists, yogis, and it's certain positions that help, and postpartum too. So even if it's just walking 5 minutes 3 times a day, or just doing jumping jacks or push-ups or something, you really want to go ahead and move, exercise for your mind, your body, and it also increases connection with your baby too. We can go to the next slide there, Shamika. What's at the end?
What we gonna do the questions?
The true or false is making the birth moms, does exercise, it makes birthing moms unhappy when they exercise. True or false, exercising helps prevent gestational diabetes. Also, exercising can help improve self-esteem for birthing moms. Y'all think, what is that, more so true or false? I think we have the answers on the next slide. So I wonder how many of you all got this right. Exercising is a good way to maintain a healthy life. That's true. Exercise is important, but it does not cure everything. So the next is makes birthing moms unhappy when they exercise. That's false. Sometimes it may feel true even to unbirthed moms, but when you do exercise, it releases, is it oxytocin? I'm not really for sure. Serotonin. It releases a hormone that's supposed to boost your mood. And to be honestly, when you do move around, especially out in nature, it does kind of make you feel better. Exercising does not prevent gestational diabetes. If you are at risk for gestational diabetes, exercising does help, and your diet does help. Having a healthy diet can kind of bring your numbers down, but it does not cure it. And it's also true that exercising help to improve self-esteem for birthing moms. That is really true. Mhm. So I think that's the end of it. If y'all have any questions about developing a birth plan, baby care plan, or even your postpartum plan, and that is something that I do help my clients with. We go over a series of questions, and at the end, I present you with a document that is healthcare worded friendly that you could give to your providers, or you can have copies around, give to the hospital, the staff at the hospital, just so you can have your wishes and desires made known.
This has been, oh, we got questions. Is there a time to start exercising?
So you can always start to exercise. The one thing you want to be sure is that you're doing it safely. And especially if you have any other comorbidities or any other disease processes that you're working with. If you have a heart issues, some exercises that you don't want to be too strenuous in. So you always want to check with your doctor, your provider, to make sure that it is safe. I know when you get farther along, there are even some movements or some places on your body that you want to stay away from because that induces labor. So you just want to be sure that whatever you're doing, talk to your doctor and make sure that it's safe for you to do.
One of the best things.
Yeah. Oh, I was just going to just piggyback that the workshop that we did, was it yesterday or earlier this week? And you guys helped me remember the 5-5-5 rule. Like the first 5 days postpartum, you should be in the bed.
Mhm.
The second 5 days, you can be on the bed. The third 5 days, you should be near the bed. And so, to quote Dr. Finlander Hines, who's a nurse midwife, if you're by the bed or in the bed or on the bed, you're not exercising. So at minimum, she's like 15 days. And then to echo I was about to say Dr. Charity's point, to echo Nasaya, talk to your physician. Oh, thank you. Somebody said that was yesterday. Girl, I haven't slept, so it's all rolling into, I don't remember what day it
One
was.
thing for doing the during the perinatal period, one thing that you can do is flat-footed squats. That is a very good exercise, and a good rule of thumb is however many weeks you are pregnant, that's how many squats you can do per day.
Oh, yeah, you
At a
guys are talking about prenatal. I think Yolanda's question was postnatal, but yeah,
okay,
okay,
yeah.
yeah,
So
that's
however
good.
many days you are pregnant, however many weeks you are pregnant,
Oh,
that's how many squats you should be doing per day. So
And
if you're
then I
24
also
weeks,
like to have keep in mind uh it varies on the type of birth that you have. So of course, if you delivered vaginally, then your exercise and starting would be different. Or if you had a C-section, then we may have to prolong when you do start to exercise again, because that is a major surgery. So that's why I always say it's really good to check with your doctor, have those rules in mind, but check with your doctor. If you had to have a episiotomy, which if they had to cut and make a slit for the opening to be more wider for the baby, that all really depends too.
any more questions? I don't see any in the chat.
no, I don't see any more in the chat. Thank you all. Everybody's here. I know we'd only scheduled an hour, but this is too rich of a conversation. And there are so many topics that I was capturing that I'm gonna beg the ladies to come back for part 2, 3, and 4. We, spend a little time on that postpartum period. We did do a workshop earlier this week. Remind me, Yolanda, what day that was? But I think there's some things, I like your style. There's some things that came from that workshop that everyone said we want a part 2 around postpartum. We need to talk a bit more about the inclusion of the partner. There's a lot to this. We will have the recording available to you. We'll work with Shamika and Yolanda to extract some pieces of the presentation that, like particularly that one that outlined your numbers or your lab, that one I was just messaging the girls and they don't have that. We do want to thank you all for joining us. Thank you, Shamika and Nasaya. Stay tuned for later this afternoon. We've got 2 workshops, one with a dad, invite your partner, invite your granddad, about the male including the male in the journey. I can't think. And then we also have getting the best of, and this is where we'll do a deeper dive, because now you know what the doctor should be doing. We're going to have a physician who says she's a reformed OB, Dr. Leslie Farrington, as well as Portia Holland, are going to talk about how to have that conversation, navigating, getting the most out of your appointments. So we'll spend a little bit more time on saying, it's my understanding you should run this test and you didn't, so I want it in my chart. And we will include these notes for you guys. I captured a lot of the notes because I love that. I'm going to try that as an old lady. If I ask for something like my diet pills they won't give me, I'm going to say I want to note it in my chart that you're refusing to let me get Ozempic pen.
Oh
Okay,
my goodness.
I'm getting slap happy. Thank you. You guys have a great afternoon. We'll talk to you soon.
Thank you.